Hello and welcome to Health Show with Amara from our London studios. I'm Dr. Amara Sohail, consultant gynecologist. In this show, we are bringing to you hot topics including health and health-related matters. We'll be inviting guests from different fields of medicine, not only to talk about the ailments, but also to discuss the challenges and the frustrations staff and patients have who have to deal with NHS on day-to-day basis. We all know NHS is one of our greatest assets in our country that provides free care to all the public most of the times at their doorstep. But there is always something or from the government that actually is questionable about the government's treatment for NHS. One of the latest examples is the junior doctor strike, where we saw the disruption in our healthcare system. Operations were cancelled, patients could not receive the treatment as per the plans, and that caused a lot of unrest within the public. Whereas some people took it as an understandable situation because of increasing inflation, high cost of living, and especially for junior doctors, salary is not enough to pay their loans and mortgages. But at the same time, some people thought it was unethical. In order to understand the ins and outs of the doctor strike, we have invited today a young medic who is a British Pakistani who will be able to tell his perspective of junior doctor strike. Let's welcome Dr. Suhail. Hello, Dr. Suhail. How are you today?
Hi there. I'm very well, thank you. And thank you very much for having me on the show.
Great. So first of all, tell us about your journey so far.
So once again, thank you very much for having me on. I'm a junior doctor. I had started my career in 2016 after graduating medical school. I did my first 2 foundation years of training in the east of England. And then after that, I did my core surgical training in the northwest of London with a view to ultimately having a career within the field of surgery. And I will be starting my specialty training, ST3 in orthopedics, this coming October.
That's great. So tell us about your opinion on the junior doctor strike, because we know that there is another one planned for next month. So what are your views on that?
So I should probably just preface my answer by saying I did participate in the last 2 rounds of strikes that we've had. And if I could just outline kind of what the strikes are and what they mean for us and what the plan is going forward. So as I mentioned, we've had 2 rounds of strikes so far, and that includes all junior doctors. So doctors from the first year of graduation, so foundation year 1, all the way up to consultancy. So all doctors excluding consultants. And essentially it was 3 days at a time in the past few months where we had all completely walked out. The service continued, but it was only emergency services that were still functioning. So A&E continued to function. Emergency surgical procedures were still performed. And essentially the teams in all hospitals across the UK were practically staffed by consultants only. As I mentioned, I was participating. So during that time, we had to abstain from work. We had to let our employer know that we were not attending work, and ultimately our salaries were deducted for those days that we did not attend.
So that's fair to hear what you're telling us, but tell us, what do you want from government? What should they do? Because we hear that Scottish government has offered the junior doctors a 14% pay rise. Do you think this would be meeting your demands as well in UK?
So as you mentioned in the intro, the fundamental purpose behind the strikes is to negotiate some form of restoration of pay. The simple fact remains that our pay as it stands is insufficient and unsatisfactory for living in modern day England. Our wages have in real terms fallen by approximately 1/3 since 2008. And I think everyone would agree that, especially in view of the COVID pandemic and the subsequent pressures and struggles that we had to deal with, our lives, our work and our job has not become any easier. If anything, it's become more difficult. with more of the British population requiring more from us within the NHS. And it's certainly reassuring to hear that the Scottish Government were willing to talk with, negotiate with the BMA junior doctor reps and suggest a 14% increase in pay. But if we're talking quite practically speaking, that's not quite exactly what we are hoping for here in England and the rest of the UK. So certainly restoration of pay by an increase of 30% is a lot to ask. We're aware of that, but it's not something that fundamentally we as junior doctors believe is unsustainable. We don't believe it's something that the government can't afford. And as ever with any negotiating, it's a starting point. So far, the government's not really participated in any form of negotiation so far. So there's nothing on the horizon to say that we're making any progress yet.
So what option do you have if government is not willing to negotiate with you guys?
So broadly speaking, a junior doctor's got, I'd say, probably three options. The first option is carry on. We'll do a few rounds of strikes. The governments will say no to our pay demands or the pay demands of our elected representatives within the BMA, and we just carry on. We accept the hand that we're given, and we try our best to make do with the pay that we have, with the promise, the hopes, the optimism, whether it's mature and justified or it's unjustified, hopes of maybe our pay increasing in following years by the time we reach consultancy, if that time ever comes, and if the NHS survives at all. The second choice is move into less training-oriented work and move into locum work, where, as most people are aware, you are working on an ad hoc basis. Broadly speaking, you're working on short-term contracts where the pay is higher, but there's no guarantee of employment later on. And then the third is simply leaving the NHS entirely, either leaving clinical practice and moving into either finance or consulting. A lot of junior doctors that have graduated from universities here in the UK have left university with a BSc, and a lot of the time it's in something completely unrelated to medicine. So either we leave medicine entirely or we continue in medicine but just leave the UK and consider options, for example, Australia, New Zealand, or perhaps more drastically speaking, studying for the American board exams and moving to the US or moving to Canada.
We just hope that it doesn't come to that option because we know that you are the backbone of NHS, and that was proven during COVID pandemic when you guys actually worked extremely hard to run the service and to provide the safe care to the patients. So what would you say to those who are very anxious about cancellation of their operations during the future strike, the operations they have been waiting for sometimes even years? What would you say to them? Because, you know, public may think that junior doctors are greedy. What is your message for them?
I mean, I completely understand the point of view of those people that are cynical or perhaps resentful towards the idea of junior doctors striking. After all, the NHS, as you mentioned, is our greatest asset here in this country, and it's something that we should fight for at every opportunity. But fundamentally, this is the whole point of the junior doctor strikes. We're thinking not about the coming months and the coming years and the number of elective operations that will have built up and the number of patients that weren't seen by their GPs during the time of those few days worth of strikes. We're thinking about what happens 1 or 2 or 5 years down the road, where the government has downtrodden the junior doctor body so much and disillusioned us and demotivated us so much that there simply aren't any junior doctors still working within the system. Again, the whole purpose of the strikes were to be disruptive. That was the intended purpose. It was not to be unsafe, and we only did it with the guidance of those institutions that could make sure that it could be done safely and legally and in a way that ensures that patients that need the care the most aren't deprived of it. But ultimately, it is to ensure the safe running of our NHS in the years to come.
Yeah, I mean, we saw that most consultants and senior staff members, they actually were on your back and they provided the care in your absence. So we have heard rumors that there might be a consultant strike. What is your opinion about that? Do you think it is ethical? Because they could cover your duties, but do you think you'll be capable of covering their duties?
I think it's a very nuanced and difficult question to answer. Ultimately, as you mentioned, the decision making in the field of medicine always lies with the most senior clinician, and usually that's the consultant within the team. So I think, to answer your question simply, no, junior doctors cannot do the job of consultants. But I also understand that as the cost of living has increased and we all have our own personal struggles and financial stresses, that consultants are justified in considering striking. Now, I don't know whether that's going to go forwards or not, but I think it suffices to say if the consultants do stage a walkout, then the situation will be more difficult and might just be dire enough to cause a significant disruption.
Thank you very much, Dr. Suhail, for your views on strike and the challenges you're facing in this day and age. We from Quews just hope that government actually does a fair negotiation with you and you get what you deserve to get and life becomes more comfortable, so that we don't lose a lot of our junior doctors to other countries, because you belong here and we respect your contributions, and we want to thank you for all the hard work that you have put in running of NHS. Thank you very much.